Hi, I'm Garvin. Welcome to our telehealth video series. In this video I will give a brief overview of what you need to know about epilepsy. In particular, I'll cover what is epilepsy, how you can treat epilepsy, and how you can better live with epilepsy. So we start with what is epilepsy. Epilepsy is a disorder that results from the firing of electrical signals inside the brain, causing recurrent seizures. Seizure symptoms vary. Some people with epilepsy simply stare blankly for a few seconds during a seizure, while others have full-fledged convulsions. Even mild seizures may require treatment because they can be dangerous during activities like driving or swimming. So for treatment, which generally includes medications and sometimes even surgery, usually eliminates or reduces the frequency and intensity of seizures. Many children with epilepsy even outgrow the condition with age. There are up to 37,000 people with epilepsy in Ireland. Because epilepsy is caused by abdominal or abnormal activity in the brain cells, seizures can affect any process your brain coordinates. So a seizure can produce temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, complete loss of consciousness. Symptoms vary depending on the type of seizure. In most cases, a person with epilepsy will tend to have the same type of seizure each time, so the symptoms will be similar from episode to episode. Doctors classify seizures as either partial or generalized based on how the abnormal brain activity begins. In some cases, seizures can begin as partial and then become generalized. So for partial seizures, when seizures appear to result from abnormal activity in just one part of the brain, they're called partial or focal seizures. These seizures fall into two categories. Simple partial seizures. These seizures don't result in loss of consciousness. They may alter emotions or change the way things look, smell, feel, taste, or sound. They may also result in involuntary jerking of part of the body, such as the arm or leg, and spontaneously censor symptoms such as tingling, vertigo, and flashing lights. Next is complex partial seizures. These seizures alter consciousness, causing you to lose awareness for a period of time. Complex partial seizures often result in staring and non-purposeful movements, such as hand rubbing, twitching, chewing, swallowing, or walking in circles. Generalized seizures. So seizures that seem to involve all of the brain are called generalized seizures. 4 types of generalized seizures exist. The absence seizures, also called petit mal. These seizures are characterized by staring and subtle body movement and can cause a brief loss of consciousness. Myoclonic seizures. These seizures usually appear as sudden jerks or twitches of your arms and legs. Next is Tonic seizures, also known as drop attacks. These seizures cause you to lose normal muscle tone and suddenly collapse or fall down. And Clonic seizures, also called grand mal, the most intense of all types of seizures. These are characterized by loss of consciousness, body stiffening and shaking, and loss of bladder control. Epilepsy has no identifiable cause in about half of those who have the condition. In the other half, the condition may be traced to various factors. Genetic influence, there's medical disorders, dementia, and disease like meningitis. Next is, how do you treat epilepsy? Medications. So in most cases, epilepsy is treated with medicine. Over the past decades, new drugs for epilepsy have become available, which allow many people with epilepsy to live virtually seizure-free lives. There are a number of different drugs which are commonly prescribed for epilepsy. The doctor's choice of drug may be limited by the fact that perhaps only 1 or 2 of these drugs are likely to be effective in controlling a particular type of epilepsy. The first-line drugs used in the treatment of epilepsy are Tegretol, Xarelto, Epineutin, and Epilium. The second-line drugs used when the first-line ones do not appear to be working satisfactorily are Frisium, Rivotril, Gabapentin, Lamictal, Phenobarbital, Mycilene, Sabril, Topamax, and Keppra. So anti-epileptic drugs do not cure epilepsy, they only control it. Some drugs work by making overactive brain cells less excitable, and others work by decreasing the brain cells' ability to transmit abnormal impulses to each other, causing a seizure. And surgery. Surgery is most commonly done when tests show that your seizures originate in a small, well-defined area of your brain that doesn't interfere with vital functions like speech. In these types of surgeries, your doctor removes the area of the brain that is causing the seizure. And there's therapies. So vagus nerve stimulation. This therapy involves a device called a vagus nerve stimulator that's implanted underneath the skin of the chest like a pacemaker. The battery-powered device delivers short bursts of electrical energy to the brain through the vagus nerve. And also to treat epilepsy, the ketogenic diet. Some children with epilepsy have been able to reduce their seizures by maintaining a strict diet that's high in fats and low in carbohydrates. And finally, how do you live with epilepsy? So the first thing is be prepared. Most people with epilepsy have their seizures well controlled by medication. However, it is best to be prepared in case a seizure does occur. So below are some suggestions. So tell people. It may be sensible to tell people about your type of epilepsy. It may be possible to give friends, relatives, work colleagues, school teachers, etc. some idea of what will happen if you do have a seizure. They may wish to learn about the recovery position if you have the type of epilepsy that causes unconsciousness. Next would be Medicalert Bracelet. So consider wearing one of these bracelets or necklaces. They give an emergency phone number where details you wish to give you about your condition are held. Medicalert bracelets are often worn by people where emergencies may possibly arise. For example, people with diabetes, severe allergies, and epilepsy. And finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist you in managing epilepsy more effectively. To start with, we have numerous products to get you started on a very gentle exercise program, such as exercise balls, floor mats, weights, and various other items which you'd require to start a program. And we create the program specifically for you. We also have various supplements and products which you can purchase from us without a prescription, such as the Medicalert Bracelet. We also have light boxes, blood pressure monitors, and body fat monitors, and assisted living devices such as grab rails, non-slip mats, and corner protectors, and more items similar to this. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us, and we help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing epilepsy with confidence. We provide you with the tools you need to live a healthy life. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.